So it's been 6 days since the surgery, and I'm about to take off the bandage that they put on my knee after the surgery. So I thought I would document what this week has been like so far, show you guys the bandage, and then show you what it looks like once I take off the bandage. The day of the surgery, they prescribed me two kinds of painkillers. One is Percocet, and the other one is Tramadol. Uh, they're both pretty strong, but they said the Percocet is stronger, so take that for the first few days. Um, and right before I left the hospital, they had me take my first two pills of the painkiller, of the Percocet. And so most of the way home, I was really comfortable, like not very much pain at all. But the Percocet does have some side effects. One of them is that it really slows down your breathing, and it kind of, you don't really notice it. So when I was almost getting home in the car, I started feeling like really nauseous and kind of sick, like I was gonna puke or something. Um, and this lasted like 20 minutes at least. I thought I was gonna have to like ask my parents to stop the car so I could like take some air or something. But then I remembered the thing that the nurse had told me about the drug slowing down your breathing, and so I just took like several deep breaths, and it made me feel better like right away. So I realized I must have not been breathing enough, and I was probably low on oxygen. So uh, that's the first lesson I learned. Like stay on top of your breathing, and if you're ever feeling like nauseous, just literally take a few deep breaths, and it'll help. And I did come across that feeling again, and almost always just breathing helped me. So they recommended that as soon as I got home, and for the first week or even several weeks, um, I follow an acronym which you've probably heard. It's RICE. So R stands for rest, I stands for ice, uh, C stands for compress, and E stands for elevate. So you want to have your leg elevated with some level of compression and ice or anything cold on your leg, and be resting. And they even told me to get a cold therapy unit, which they come in different brands and slightly different mechanisms. But the idea is you put a cuff around your knee, which has some tubes inside for cold water to run around it, and you connect this with a tube to a tank which cools water and circulates it around and keeps your knee cold. So I actually have mine on right now, and I'll show you guys. So there's the part that goes on your knee. As you can see, it's kind of, you can tell it's full of water. It's full of cold water right now. And so that provides both compression and coldness. And so it's connected with this tube to this tank here. I have it hung up on this thing because the one I have, it's it works based on gravity. So you fill this tank up with cold water and ice, and you connect it to this tube, and you put this on your knee. And since this is higher up than your knee, water will flow down uh, and fill this with cold water. Now, the higher you place this, and that's why I have it hanging up on a hook so I can uh, change the height. The higher you have that, the more pressure you'll feel on your knee. So yeah, like I said, mine is gravity based. It doesn't use any electricity or anything, but there's some that you have to connect to the wall, and there's some that have like a battery. And in those cases, I'm pretty sure you don't need to have them raised at any particular height. They take care of circulating the water around and of compressing your knee. So whatever you prefer. I think maybe this one's cheaper. I actually just rented this one, the tank, for $40 for 8 weeks. And then the actual part that goes on your knee, I had to buy, and that was like $150. But the people at the clinic told me specifically to get this before the surgery. So I did, and so far it's totally been worth it. It lasts really long. Like you fill the tank with ice and cold water, and you won't. If you're doing this all day long, you probably need to change the ice like once. Um, and so the way it works is the water will flow down into the cuff, fill it up with cold water, and then after like half an hour or so, it won't be cold anymore. So all you have to do is take the tank down from the hook and put it on the floor so that the water flows back into the tank, mixes back again with the ice, and so it cools the water again. And then you just put the tank back up, and it'll bring water back into the knee cuff. So every half an hour, or sometimes every hour, all I have to do is take down the tank, put it on the floor, wait like 10 seconds, and then hang it back up, and it'll fill up with cold water again. So I found the cold therapy unit really helpful. So on the day of the surgery, I got home, and I actually wasn't in very much pain at all. I would say it was a 3 or 4 out of 10 in terms of pain. That's probably because, one, the nerve block that they applied on my leg was still active, so I couldn't feel anything. In fact, there was parts of my shin that if I touched them, I wouldn't feel anything. So that definitely played a role. And then I was also taking the painkiller. So first day and even the second day, I didn't feel very much pain. I was just lying with my leg up, watching TV. Now the third day was actually the most painful day of all. Uh, I don't know why. Um, One thing that I learned after that day, which has helped me keep the pain away, is I've learned to properly like put my leg up on the couch or put my leg up on my bed without bending it. So in other videos that I've seen on YouTube, a lot of people after their surgery, they get a big brace where they can adjust like the degrees that they can extend and bend their leg. I didn't get that. All I got was like a bandage wrapped around my knee. So whenever I would put my leg up on the couch, it would kind of bend a little bit, and that would really hurt, and that would keep my leg in pain for like maybe half an hour or something. So I've actually made up, or actually I think I saw it in a video. I I started using this method of putting my leg up on the couch or on my bed, which basically just uses one of these elastic bands that I got at physiotherapy from before the surgery. And basically I just put it around my leg and then pull with my arm, and that raises my leg. And that way the leg doesn't bend, and also that way I don't need to like exert any force with my leg, and that totally allows me to put my leg up on the couch or on my bed without any pain. So that's really helped with the pain. But that third day, like I said, I hadn't figured that out. And so between like putting my leg up on this or that, and also just like the nerve block uh, ending, I was in a lot of pain. I would say like a 7 most of the day. I couldn't, I wasn't even, I couldn't concentrate on watching TV or anything. It was really an uncomfortable day. But with the elastic band technique and with the cold therapy unit, the fifth, sixth days have been fine. They've been quite comfortable. So I'll actually show you guys a video of how I'm using this elastic band to raise my leg, and how you guys might do it too. So now I'll show you the bandage that they put on my leg after the surgery, which I still haven't taken off since the day of the surgery, and which I'm about to take off now. So that's what it looks like. Actually, I lied. I have taken this off, and that's why it's all loose, because they applied it too tight, and so I took it off and put it back on, but less tight. And then this is, I just put a big cushion in a plastic bag so I wouldn't get it sweaty or anything during these days. So I've had my leg up like this almost all week. So just to show you guys, I'm actually going to take it off right now, just this outside layer, because there's some gauze underneath, and I'll warn you right now, there's some blood on it, so you may not want to watch this part. It's attached with some Velcro. So that's what it looks like. This is all just gauze, and that part there, that's like dry blood. And so this part I have not lifted since the surgery. They told me the way to remove this is to go in the shower and put some warm water on, and this will come off. So I'm gonna take a shower in a little bit, in a few minutes here, and then I'll show you guys what it looks like afterwards. But yeah, this is as much as I've seen as well. And I've taken this bandage off and on a few times. It's just this part which I haven't removed yet. So they actually said don't shower for the first 4 days. That was in one of the documents that they gave me, but one of the nurses said you can go ahead and shower, just put a bag around the the bandage and seal it, and you can shower. So I've done that twice, where I just put a big garbage bag over the entire leg and seal it at the top with some tape, and then I can have a shower. I can't stand right now. All I can do is use crutches. So when I'm showering, what I've done is actually I just put a chair in the shower, and shower sitting down, and that's worked fine for me so far. The other thing which I've learned this week is that it's important to have your leg raised, but it's also important to have your torso uh, down as much as you can, like horizontal. For example, yesterday I left the house for the first time since the surgery. I went for dinner at my cousin's house, and I just had dinner on like the couch with my leg raised, but I spent probably like an hour and a half or maybe 2 hours uh, sitting on a couch with my legs extended on the couch, but my torso was like vertical. I was sitting, and by the end of the night, my ankle was really swollen. And what matters there is like the position of your knee relative to your heart. So if your heart is above your knee, uh, your leg will swell. Um, and if your knee is above your heart, it won't swell as much. And so most of the week I've had my knee above my heart, but yesterday I spent like 2 hours with my heart above my knee, and it got really swollen and hurt a little bit. So I don't recommend doing that. So in terms of physio and range of motion exercises, I haven't been able to do very much in the first week because of pain. I can't put any weight on my knee yet. When I use crutches, I'm not really putting any weight on my leg at all. Uh, One good thing is that I'm able to extend my knee fully. It's been 6 days, and probably since like the third day, I've been able to fully extend my knee, or at least almost fully. I'll show you right now. So I spend a lot of time with my legs up on a big pillow, but I also am trying to spend some time with my legs just fully straight like this. And the injured leg, the injured leg will get tired after like 20 minutes of being straight, so I have to put it back up on the pillow. But I'm happy that I can fully extend it. For bending it, I'm not quite at 90 degrees. I think this is as far as I feel comfortable going. So almost 90 degrees. There's a physiotherapy pamphlet that they gave me after the surgery, which says the goal for the first 3 weeks is to be able to go fully extended, which I've already reached, and a little bit past 90 degrees bending. So I still haven't gotten there yet, but it's only been 1 week. So I'll keep working on that. The pamphlet has some exercises for me to start working on. I'll show you some of the ones that I've been able to do. So one of them is just to raise this leg like this as far as I can go, and then slide it back down to full extension. And then again. The other one, this was good. This is the only thing I could do in the first like couple days, was just move my ankles around like that. Another one is just with your legs flat like this, contracting this muscle here, just contracting and holding. I don't feel like I can do it very well with this one, but that's part of the exercise, just trying, contracting, and then letting go. There's another exercise in the pamphlet, which is raising your leg like this, but I really just can't do it with my operated leg right now. When I try to lift, all I can lift is the top half, but I can't raise my full leg up off the ground. So I'll keep working on that. So that's it for the story of my first week of recovery. Just as a reminder, I got patellar tendon graft, so some things may be different if you got a hamstring graft. In my next video, it's going to be a really short one. I'm just going to show you the process of taking off the bandage and what the scars and wounds look like afterwards.